Welcome to 𝗖𝗵𝗵𝗺. We are discussing the skin, soft tissue and musculoskeletal system, and this is our second class, and the topics of the discussion are leprosy and anthrax. My dear children, please understand one thing. In order to avoid overlap of the topics, I am making it very clear that in this session we will discuss about leprosy because Bacillus cereus. You remember we have already discussed Bacillus cereus as well as Bacillus anthrax, car and everything in the topic of GIT. So, the link of that I will put in the description. Please go check that video in order to read the anthrax, but in this video we will mainly discuss about the leprosy. So, leprosy, first of all you should be aware of this image. Okay. So, can you see this? This one, these pink one are the acid fast stained bacilli. Okay. Can you see this? These pink ones are the acid fast stained bacilli. Okay. So, this is acid fast organism, and if you remember from the stains video of our general microbiology, there I told you it utilizes approximately 25% of H2SO4, my dear. Now, what is this? This is a patient who is suffering from leprosy, and today you and me are on the mission to heal this patient. So, let us understand about, oh my God, see here, the skin manifestations of leprosy. Okay, my dear students, this is how it infects the skin. So, let us start with the leprosy. I hope that you all are aware about the causative organism of leprosy, that is Mycobacterium leprae. Okay. They now they are written, they write that it is weakly acid fast, like it requires only 5% H2SO4. Okay. Yeah, it is 5% only. So, sorry for this 25%, it is 5% only. Okay. 5% H2SO4. Okay, I will make the confusion clear here. 25% is used for Mycobacterium tuberculosis and Mycobacterium intracellularly complex. Okay, or you can say, yeah, okay. So, please understand that this we are discussing about leprae, and leprae requires low dose, L for leprae requires low dose of H2SO4. Coming on to microscopy. So, whenever you will see in the microscopy, you will have some macrophages. Okay. So, this is a macrophage, and how it will appear to you, just like a cigar bundle. Okay. A bundle of cigar. Okay. So, cigar bundle appearance inside the macrophage. I hope that okay, this is not very clearly visible in this, slightly it is visible here if you can see. Okay, this is the cigar bundle shape inside the macrophage, not clearly visible. So, we will not look into this picture. So, cigar bundle appearance in the inside the macrophage. So, what are the cells involved? So, remember this macrophage, when it has the cigar bundle of Mycobacterium leprae, they are called as 𝗵𝗵 cell, lepra cell, 𝗲𝗵𝗺 cell. Either they will be called as 𝗵𝗵 cell, or they are called as 𝗲𝗵𝗺 cell, or they will be called as lepra cell. Why lepra? Because it is having Mycobacterium leprae. Okay, and other two you have to remember, 𝗵𝗵 cell and 𝗲𝗵𝗺 cell. Please remember, eliminated disease, leprosy is an eliminated disease in India, and no new case has been reported in past. That's it. Okay, we don't have cases of leprosy nowadays in India. Okay, how it is spread? So, the mode of transmission is going to be inhalation. Okay, and the contact with the broken skin. So, while teaching you, I have told you many a times that the Mycobacterium species, they are actually obligate anaerobes. They are what? They are obligate aerobes. They love oxygen. That is why whenever you will see tuberculosis infection, tuberculosis love to stay in the apex of the lung. Why? Because the oxygen concentration is very high in them. Okay, in the apex of the lungs, the oxygen concentration is very high. Got it? Good. So remember why I told you all this? Because mycobacteria also loves oxygen. So it is also getting spread with the air, that is inhalational route, that is the droplet infection. But because we are discussing them in CVS, I mean in the skin tissue infection, so it is also transmitted via the broken skin. Coming on to virulence factor, that how this leprosy is happening. So for example, this is the organism Mycobacterium leprae. Leprae is having itself in the name 𝗵𝗵𝗵𝗵. Okay, so L and P are important. One P is phospholipid. Next L is lipoarabinomannan. Okay, this is also a virulence factor, LAM factor, lipoarabinomannan. And you have got another P that is called as phenolic glycolipid 1, PAGL. Okay, so if you know what is meant by PAGL, PAGL means stupid. So PAGL, so PGL, that is phenolic glycoprotein 1. Okay, so remember like this. So do you want somebody to suffer from leprosy? No, I don't want. So no leprosy. N for NHSP. So this is a heat shocked protein. So these are leprae specific secreted proteins. NHSP you call it as. Okay, but okay. Now coming on to the culture media. Remove this. Yeah. Coming on to the culture media. Remember, there is no culture media. Hence, Mycobacterium leprae grows in 9-banded armadillo and the foot pad of mice. Okay, so in order to grow leprae, you have to go to the foot pad of the mice and 9-banded armadillo. See this picture. This is the 9-banded armadillo. This picture is asked in the questions. Okay, so remember 9-banded armadillo and responsible for growing of leprae. Similarly, it can even grow in the foot pad of the mouse. Okay, so foot pad of the mouse maybe ye grow karta hai. It also grows in the foot pad of the mouse. Coming on to type of leprosy. Now, I hope that you are well aware of some basic nomenclatures like the 𝗲𝗵𝗵, like the multi. So 𝗲𝗵 means less, multi means more. For example, if a leprosy is paucibacillary, for example, if a leprosy is paucibacillary, that means less bacteria. Why there are less bacteria? Because the cell mediated immunity is good. So these leprosies are called as tuberculoid leprosy. These leprosies are called as tuberculoid leprosy, whereas if 2 times leprosy is coming, that is leprosy, Lepromatous leprosy, that means it is dangerous. It is multibacillary because many bacteria are there, multibacillary, and the cell mediated immunity is also less, my dear friends. That's why the features are going to be severe. They are going to have multiple bacilli and the organisms will also be visible. This is the Lepromatous leprosy. So the picture which I tried to show you here, this is severe one. So this is an example of Lepromatous leprosy. This is an example of Lepromatous leprosy. Okay. Now there is something which is called as lepromine test. So in order to check for the immunity, for example, if a person is suffering from leprosy, okay, for example, a person is suffering from leprosy and you have to check the immunity, you will do lepromine test. And can you see I and M coming in lepromine? This is for immunity. I and N coming. So lepromine test is for immunity. So I have told you Lepromatous, because 2 times leprosy is coming, Lepromatous leprosy, this is a severe form. So immunity is less. That is why lepromine test is going to be negative. So what you do, you inject an antigen, okay, a smaller antigen you inject, but there will be no inflammation. So why there is no inflammation? Because the immunity is low. There is nobody to fight from this bacteria, and if there is no WBCs who are coming to fight, there will be no inflammation, and that is why the lepromine test will be negative. Similarly, in tuberculoid, you have got a good immunity. The cell mediated immunity is good. So, you will have the inflammation and lepromine test will be positive. Okay, you got it? Yes. So, talking about the clinical feature, one was the lepromine test, second is the nerve involvement. So, nerve involvement is common and the skin involvement is also common. Okay, skin involvement and nerve involvement is common. For example, it is a paucibacillary, then there will be less than 5 skin lesions and 1 nerve will be involved and smear is not going to show any bacteria. Whereas if it is multibacillary, it is going to show more than 5 skin lesions, more than 1 nerve involvement, and the smear is also going to be positive. Okay. So, we divided them into 5 categories on this basis. What? One is the Lepromatous leprosy, then Tuberculoid leprosy, okay, and Lepromatous leprosy is the most severe one and this is the mildest one. Okay. So, how do we divide? Tuberculoid leprosy and then you have got borderline tuberculoid leprosy. Similarly, borderline lepromatous leprosy and then you have got borderline, okay, just like the borderline leprosy only. Okay, you got it? Very good. So, this is how we have divided. Okay. Coming on to the lepromine test, yes, we were discussing for the immunity. So, what happens, please understand. So, you study the lepromine test, MIM and for immunity which was being done. So, you study in these 3 phases. One is the 2 phases, early reaction and the late reaction. So, there is a reaction which comes early in 48 hours and there is one which is coming late in 4 weeks. Okay. So, remember the early one is called as Fernandez reaction, late one is called as Mitsuda reaction. Just like alphabet F comes earlier than M alphabet. Okay. Similarly, Fernandez reaction is early and Mitsuda reaction is late, which is the antigen which you are putting. So, it is called as 𝗲𝗵𝗿𝗺 antigen or the Mitsuda antigen, but 𝗲𝗵𝗿𝗺 antigen you have to keep in mind. Okay. Fine. 2.5 kilo ka haath, remember father name is Dharmendra only. For the Hindi speaking students, you must be understanding what I am trying to tell. So, how will you diagnose it? So, in order to diagnose, we have got one, the skin slit smear. So, whenever you see ki, okay, leprosy is going over in the pinna or on the face, you just take a skin smear out of it. Okay. So, generally taken from the earlobe, skin lesions, okay, and then you stain it with the acid-fast stain or the Ziehl-Neelsen stain, okay, and the red bacilli will be seen properly. Okay, red bacilli will be seen just as I have shown you. One. Second is going to be leprae reaction. Now, what do you mean by leprae reaction? So, leprae reaction means, okay, the test was called as lepromine test for the immunity, whereas leprae reaction is something which you have to understand. Leprae reaction means there is an acute inflammation which occurs during the course of leprosy. Okay. So, there is an acute inflammation which is occurring. Okay. So, seen in the patients who are already diagnosed with leprosy. Okay. In order to check that if the disease is progressing or not. For example, there are 2 types of leprae reaction, type 1 reaction, type 2 reaction. So, type 2 reaction is called as erythema nodosum leprosum. That means erythema nodosum leprosum means that in the cases of lepra patient, there will be inflammation, and once this inflammation is happening, the patient is going to show what? A patient is going to show the formation of nodes now. Okay. So, this is the erythema nodosum leprosum, and then you have got type 1 which is seen in the borderline cases. Okay. But one thing I would like to tell you, please write 1, 2, 3 and 4. That means type 1 reaction is type 4 sensitivity, that is a hypersensitivity reaction, and type 2 is a type 3 hypersensitivity reaction. So, type 1 is a type 4 hypersensitivity and type 2 is a which one? Type 3 hypersensitivity. Okay, clear? Yes. So, this is again different an important part, lepra reaction. So, you must be aware of that. Okay. After that, yes, coming to the treatment part. Now, treatment, there is a multi-drug therapy which is followed. Let me just tell you about this multi-drug. So, you are going to give the multi-drug therapy to these patients, right? Just 1 second. Yeah. So, there are 3 drugs which are given. So, what are the 3 drugs? The 3 drugs are rifampicin, dapsone, clofazimine. Rifampicin, dapsone and clofazimine, which is given to these patients. Okay. Rifampicin, dapsone and clofazimine. So, although the treatment of leprosy is very important, but I am not going to discuss it because pharmacology faculty is going to deal with the treatments of rifampicin, dapsone and clofazimine in context to leprosy. So, I will end my lecture over here. So, thank you so much for joining and God bless you. I hope that you are liking the lectures, and in the comment section you will share your love, care, support and blessing, and please do share the feedbacks if any. Thank you.